You are live.
Thank you. You want to push the button?
There you go.
So this is committee of conference on the 2023 budget. And we hope to deal with maybe some of the more either technical corrections or some of the language changes. And hope that obviously we've passed a budget in response to what the House did. And now you're, I'm sure, taking a look at what we've done. So if there's certain areas that we could look at, maybe close out this morning.
Yeah.
That might be, make us all feel good that we're making progress.
That we've done something, we can start the day doing something, which is lovely. So yes, there are obviously a handful of the usual sort of technical corrections. And then we also have a couple of questions about a couple of sections. I'm sure we'll have lots of questions about lots of sections, but there are two that we're wondering about right now. So just beginning at the top with some of the technical agreements. So A106 and A108. It was very easy.
Oh, right, moving right along.
Yeah, federal, it's technical updates about federal funds and changing the legend.
Mm-hmm.
We agree to B400, which is quote, restoring the 500,000 for general funds for the operation of the Vermont Job Board Labor Exchange. We've heard about this at the tail end of their being with us. Honestly, the Department of Labor, we had a very hard time understanding their presentation. It was quite confusing. And so we knew that there might be a change here. And we also received a letter from them about their IT funds that we're not ready to talk about. I just need to say yet another confusing, because we had carefully talked to them about their IT issues, had a good plan, and now they're suggesting that the plan that we agreed to wasn't going to work. But I'm getting ahead of myself. I'm just expressing a little frustration.
Well, I think
clarity.
what you're saying is sometimes a decision is made out of confusion rather than a deliberate action to take away base funding that was necessary.
Yeah.
So,
yeah. So we're good with your proposal for B400. B808, this is kind of the National Endowment for the Arts sets their budget after it leaves us, and this is the matching money. So we agree with that also. Down in the C section, C103, added a couple of psychology and social work to the programs that are allowable, and we're good with that. I will at some point worry about spreading what the peanut butter too thin for us to be able to taste, but we agree with that. Similarly at E100.2, good call. Let's use the Chief Performance Officer and be clear about that. So thank you for that. We agree with that. E126, again, just adding language to allow the transfer of funds between the different branches of government. We allow that in the executive to some extent, and so we should give ourselves that flexibility. So agree with that. E136.1, just extending the date on the Ethics Commission. That's how we're funding them. So allowing more time to put that into place. The next one right below it, E139, the Grand List litigation assistance. We agree with you on that, just changing the language to reflect what needs to be done. And then on the community broadband, we accept all of that, so that's E233 and then .1, .2, .3. So those are 4 sections that we're agreeing to.
Sometimes when you look at something and you say, well, no, but there's just, you can spend up to, something about up to 1.5 or whatever. So they're working on a budget now.
Yeah.
So that was just something, sometimes you discover things that are strange, so thank you. So 1, 2, and 3?
Yeah, so the 233 and then 233.1, .2, .3.
Oh, 4 sections.
Yeah, 4 sections, yeah. And I imagine that over the next couple of years, it will continue to evolve this. It's a new concept, and we'll keep putting belts and suspenders or giving or taking away work, et cetera. So this isn't surprising at all. And then down to E313, the report on the public inebriates and sober beds. We will have questions, and actually maybe Peter, we can go back.
So the 2 questions I have right now are not in regards to
Not
that.
related to that,
Right.
okay,
But this is not, there is money obviously, but it's not in here. This is a report.
yeah.
It looks like a really good idea, so.
I'm sorry, the number was 2.
Yeah, 313.
Okay. So did you say you were agreeing to that?
Yes, we agree to that now,
Report.
but yeah. The one
Really,
above.
we're struck by, we were hearing that mental health agencies had beds for public inebriates, now they're called sober beds. And like Lamoille County had 4, and they staff them and they're vacant. And then at the next breath, we've been looking at, the whole issue of people who are ending up incarcerated. So it was kind of a surprise that we would have unused capacity at the level that we were getting. Now, maybe there's more to it than we have, that we know right now, but it was like hard to understand.
We were similarly surprised. I'm trying to remember if this was in testimony or what I've heard. So I'm not sure who the we is on that. But I heard also that they were unable to staff them and were making decisions about where to have staff. But Senator Sears were with us. I mean, some of my first legislative experiences were learning from him about the use of sober beds and the prison population. And so it's really discouraging that we, in 14 or more years, have not solved that, what should be a simple solution.
Well, on the other hand, we thought it was because there wasn't capacity. That's why it's so shocking to say, oh my gosh, there are 4 beds in Lamoille County totally unused.
Yeah.
And in fact, that's the case. So it's hard to reconcile the two pieces of information. So maybe at some point we can understand it better. Yeah.
So we'll get a report on it
Yep.
and find out what's
Work from there.
actually happening. The next one that we have is on the needs, 605.1, E605.1 near the bottom. And this is what we dropped the language, and so we're just restoring the language
Yep.
there.
605.1 needs
Right.
based stipend.
Yeah, we will have a conversation about dual enrollment later, but
We, as you can see, I read in the paper that the bill that dealt with dual enrollment and the court decision was part of a larger bill that probably is not going to see action in the House. So this carried an appropriation, 75,000 Ed fund, 75,000 general fund, but it was to deal, and Senator Baruch certainly knows a lot about that as former chair of education, but to make sure that Vermont students, even though they might be attending a private, a parochial school or would have the benefit of that benefit. So we did add the language, and then AOE sent some language saying, or it sent an email that said, what we had, we need to change. So I just want to say that if the agreement is that we're going to comply and provide that benefit, we have an email saying the language should be modified.
So just to be perfectly clear, what we're agreeing to in 605.1 is simply it was language that was dropped inadvertently. You caught it, great, good catch, but it has to do with, helping kids who.
We were very familiar, came out of this committee. Senator Westman, I think probably by being on VSAC, was saying if kids from more limited income families don't have help with transportation or their books, it in fact is a benefit that they can't access. And we viewed it as a form of social and economic justice.
Yeah, it's really important, it's standard language, but the other conversation about funding for dual enrollment in religious institutions we're not agreeing to that, and I think it deserves a much larger conversation.
And it's been long running between the chambers, and perfectly happy to continue. My sense was that the legal situation had changed, and there was more urgency, but happy to at any point discuss.
Yeah. Okay. Thank you. And I mean, it's probably the headline for us is this is a very significant and important decision that deserves to stand alone in the decision-making process and not to be within a budget. And so our view is that it should be taken up in the bill, which the Senate has proposed, and we would prefer to see it. I think you all proposed it. I think
It's in 219.
Yeah, it's an S bill. And we know that it is in-house education. As you know, they've also been attending to a few other important pieces of work and haven't been able to get there. But our preference would be that the whole conversation around dual enrollment as it relates to religious institutions be dealt with there rather than in the budget.
I see them as related, but I see them as ability to separate them. And I don't know if your education committee is willing, in light of that court decision, because we're talking about benefit to students as opposed to where public tuition dollars are going. So that's something that I guess you're going to have to discuss whether whether you can act on one piece for those Vermont students and the other, where the limitations on tuition, state paid tuition.
Yeah, and the largest discussion that's out there, I think, and again, some difference between the chambers, is about whether state dollars should flow to independents at all. And some people thought 219 was draining the urgency from that discussion to create a major change in our system. And again, I think it's a fair question, and it's a big question that will take years for us to resolve. I had been looking at this as a smaller piece that was, because of the court situation, had been clarified enough that I thought maybe we could expand in the absence of 219 in the budget. But I hear you clearly that your preference is not to have here, but to have it elsewhere. So in other words, no agreement on that.
Right.
I guess then what you're saying is you have already heard from your chair of education that they're not willing to at least provide the dual enrollment benefit to the students who are attending parochial schools.
That is correct. They would prefer, and perhaps it's not, let me restate that. They would prefer to see this issue dealt with as through the legislation. There is a concern that we may, by allowing a narrow benefit, that we open up the door to what the other benefits are. Now I don't want to misstate their position, but in my mind, it is as if we are establishing a precedent that will then push the door further open. Those are my words, and I'm a little.
I think there has been a precedent established, I just think it's legal. And we're playing catch up to the Supreme Court, basically.
Yeah.
But, you know, I'm pleased with the amount of agreement we have so far, so if that's one difference that's outstanding.
And maybe there'll be further discussion.
Yeah, Yeah,
So, but not for now.
but not for now. And I mostly just wanted to be clear on what we were agreeing to and what remains an important issue. That gets me to the end. I don't have any other, the kind of easy technical ones that we could clearly see. We did have a couple of questions, one of which,
Just a couple of things I wanted to ask. The Beamers we put in, and that has to do with the municipal employment employees and their retirement system.
yeah, did I not get
No,
that?
it's 134, and that was simply to implement those agreed upon changes and using the budget as the structure. And so I just wanted to ask whether, and the other one, it's Farmers Night, and that was just simply, there was a desire for some groups maybe to pay a stipend and allow it to be paid out of the legislative budget. So those are pretty, one is just recognizing that the contribution rates needed to be adjusted for the municipal. This was, we didn't change any of the language.
Yeah,
And the other was allowing out of the legislative budget to do a stipend. And no new money, just authorization to do it.
so yes, it was a mistake. I should have said yes to the Beamers. Thank you for putting that in. That was again another one of 134, E134. That was something that came to us at the very end, and I'm being careful about pension language in general, and so thank you for thinking it through.
And we didn't think it through. We let somebody else think it through and said it was agreed to, and it's something that we've done periodically in the past, so.
every 4 years,
Right.
according to our research. And it was more just double checking that it really was agreed to.
And then
So on the
Farmers Night.
farmer's night, the only reason I didn't say yes to that is it says the legislative budget in the language, and I think it ought to say the General Assembly's budget. And I just had, so we can just say that.
We can do that.
You can do that without a piece of paper from us.
Yes, we could, from the General Assembly.
Yeah. Yeah, okay, so that's 128.1. So that is allowing, farmer's night and paying stipends for farmer's night. That,
Okay,
So thank you
so
for-
with that language change, make it the General Assembly budget?
yeah,
All right.
okay. And then, so here's another housekeeping one that you picked up, which is the funding of the Pay Act. And historically, it's either been a Pay Act or it's been in the budget. But historically, it has also always been for 2 years. And so we were curious why you just did it for 1 year.
We didn't have the numbers for the second year, and this was basically a holding place to put the whole pay act in.
Okay, so let's.
And I don't even know, what is the fate of the Pay Act bill?
Well, there is no bill, so they're asking us to drop it in here. I know that our side, that we've been taking testimony or on it.
I don't know if
Yeah.
Seneca Ops has paid much attention to it yet.
So we just wanted to recognize that like some years may have to be lumped into the budget.
Yeah, so I think it needs to be not just 23, but 24. So we'll get the.
And all the statutory changes.
In all of the stuff, yeah, it's a pretty, when I was reading your bill, I was like, where are the next 10 pages? That
But
it's a long.
that wouldn't be a bill, you said, it's not a bill.
No, there is a draft, but there is a draft of it that's been done by legislative council. So they have been preparing something that would be the equivalent of a bill that.
All we're doing is anticipating
Yeah.
that probably state employees would like to have the funding for those salary increases. So,
Just a thought.
yeah, so, all right, well, we'll have to just say that's open until we get the
Yeah, we get
language.
the language.
But, and who's vetting it, you think, our Senate?
So I
or
don't
your
know,
House?
I'll check with Senator White. I don't know that I know the House GovOps Committee has looked at it. I just don't know that the Senate GovOps Committee has paid much attention to it.
Okay, and then the other area that we had a question on is in B 312 in the public health section, and Peter knows.
So just-
that.
It's really just a couple of questions to understand what it is, because we've heard nothing of these. It's in regards to the comprehensive care clinic for HIV/AIDS at UVM. I heard no request. I heard nothing. I didn't know they had one there. Can you kind of tell me what's going on?
Yeah, we got that request, I think, after the budget. We were getting funding requests, even when we were marking up. It was incredible. I think everybody was like saying, well, at least with a grant application, you have a deadline. We didn't even have that. It came, and Senator Westman, and I'm gonna let him speak to it. He followed up, and it's a mobile unit. They do blood draws, and so it's a direct healthcare service that is provided to a vulnerable population. And it was, I believe, 100,000, is that right?
Yes.
And so I can give you the paper, but that's what it is designed to do. So let me see if I can find the request if you want to see it.
Please.
But Senator Westman had a follow-up conversation about exactly what are the services provided and to who. And if he were here, he could answer it. So maybe we could,
I could probably also trip him in the hall.
yes, you could do that too.
Yeah, okay,
And then the second one is the 103,000 for Vermont's free and referral clinics. Is that all the free clinics around the state
Yes.
divided equally? Okay,
It was-
yeah, we heard nothing from that. It must have been something.
Yes, that was another one that came in, and I believe it was, yes, and it was it a 10%? I can't remember.
Yeah,
At
it-
102.
Yeah, it was a 10% increase on their base of $1,028,000.
So we thought, considering the population that they serve, that was something that we wanted to support. I believe there's one in Barry, right?
Yeah, there is.
Headed up by Peter Young-Bear. They're around the state.
I don't know if he's doing that
I
anymore.
think he
I
retired.
think he retired, I'm not
So that's
sure.
what,
Yeah.
I wanted to make sure. It's a long
Yeah.
time donated for my wife and I donate to our local. I just wanted to
Oh.
make sure it was all.
well, now you're donating more. If you
Kind
accept
of,
that,
kind of.
if you accept it.
Thank you.
So that was the request. I think they operate on a shoestring. They have a lot of volunteer
Yeah.
professionals.
Yeah, they do.
And so we felt that, and one of our priorities were, what were those critical systems serving Vermonters most vulnerable and trying to get them shored up a bit. So that was our thinking, obviously, with, oh, here comes Senator Westman. Channeling him.
Yeah. Hello.
Good morning. I know it's Monday.
You're lucky enough not to have morning meetings.
Oh, gosh, we're stuck with each other all day long.
I don't know which is worse. Let me, Senator Westman, the question was raised, remember you had done more work on the clinic out of UVM, the mobile clinic that does the blood draws and so forth. And that was a request that came in after the House did their budget. Could you just give a little background on what you found?
Jeez.
Or we'll give you a
Maybe
second to
yes.
breathe.
Or
and-
we can do it later.
If you could do it later, it will allow me to go back and look at my stuff.
Okay.
So we've heard nothing, so I just,
Well, yes, it really is hard to keep up. And so we did keep adding to the list. of requests that came in.
As I remember it, the mobile clinic had two pieces. One, they draw blood, and one is a mental health piece. But I would much rather go back and
Okay,
take a look to make sure I didn't.
I think
miss
that's
out.
right. They were talking about the,
There was 50 and 50, I think, but I'm leaning it off.
Yeah. We just like to understand it a bit more before we say yes, since it was new
It's-
to us.
One is nurses to draw blood, and the other was had a mental health component, but I need to.
Okay.
Great, thank you.
So you came just in time because I think we're finished. We had nothing else to.
you have nothing.
Oh, we can do that, yes, yeah, I'm sorry, we do have actually one more piece of language. Which was,
Oh, I happen to have the request.
oh, okay,
Is that UVM?
Yes,
Yeah.
I sent the members the free clinic request.
And you,
that's what I've got right here.
Yeah, I
You
have
need
it
this
someplace.
Well,
so it came
No,
from the
no,
UVM?
well, the UVM one I have not sent, but the free clinic one I did.
Okay, good.
Oh,
Thank you.
okay.
Is that UVM?
Yes, this is the UVM. We can make a copy.
Yeah, I'll get a copy made, no, no, thank you.
These are the requests.
that you've got, yeah. We do have a suggested language change, so, this is in B 131. This is for the volunteer income tax assistance
We
program.
didn't fund it.
I know you didn't, and we presumed it was because in part you heard from AHS that they would require 2 positions to fund it.
Well, that was part of it, but also we felt that this was a new program. We looked at the information. And when we were looking at how we wanted to support families, we put money into parent-child centers. And so it was a matter of where, and this would be also out of the caps. And so it was just a matter if we were adding a new service, or to some extent this is being done now, but, and has been. But we didn't fund it simply because our first priorities were shoring up those programs already in place before we started adding new ones.
Can I speak to that for
Yeah.
a minute? So you're right, Senator Kitchell, that it is already in place. Right now, the 2 most active CAPs doing this are CBOEO and Capstone here in central Vermont. And what the program does, to your point about really focusing on the most vulnerable, is it has people who are trained, and it leverages all kinds of funds, from 200 volunteers to IRS tax grants. And what it does is it helps households, not individuals, but households that earn less than $58,000. The adjusted gross income level of folks helped in this program is $18,000 a year. So a scenario, you have a single mom, she goes, she needs funds to pay for things in her household. She knows her tax credit refund is about to come due. She goes to a for-profit, she pays a fee, usually the minimum fee is about $125. And in some cases, they will give her funding in advance, and then they will take $200-300 off of her refund. So the population that is served by this, primarily, it's the elderly, it's English language learners, it is the disabled, it is single parents, it is students. And the way that, what I found compelling is that this is money that is on the table. So these are people who would be qualifying for various tax subsidies or write-downs that are not necessarily being collected by them, because we are leaving them on the table, because we don't have the statewide.
This is not a dispute about generics. It's about where we would, and the reason we wanted to bolster our parent-child centers, that I don't think you increased at all, was because of the UVM study relative to children being brought into the custody of the state. And they said, as a state, we invest less in prevention than many other states. And their recommendation was to really look at those systems. So if we can't agree with this because it's part of the overall what we have for funding. And you will notice in the Parent-Child Center, there's language that in fact, we want them to focus their services on the families where the children are at greatest risk of coming into the custody of the state. So that's been an ongoing priority for us, is why is Vermont such an outlier where children are having to be removed from their families and end up in the child welfare system. So we put quite a bit of money there to carry out. So this has nothing to do with the merits. It just had to do with the amount of funding available. And so I think what you're asking for is, let me understand this. The language here is you're asking that we would concur with your 400,000.
Correct, and it would go through the treasurer's office, so there would be no additional staffing costs through AHS. It would be done in a contract. The contract would go to
All right, so what you're
CPO.
attempting to do is say, DCF doesn't need the 2 positions.
Correct.
However, the fundamental question is
the
the funding of the service.
So we understand, we can't resolve the
No, you
money
can't, not
issues
without the
yet.
money.
So
We wanted you just to know that we were concerned that an objection to this was the 2 positions. We found a workaround, so you can just stick this in our packets and we can hold on until we
When we get
resolve
the
the
money.
I just have to ask, this 400, as I understood it, and correct me if I'm wrong, was on top of the program they already offered. And this was to move not into, to areas, the larger communities. This was to move the program through the community action agencies into the more rural areas of the state. So are you suggesting now that we would run 400,000 through the treasurer's office and the existing program still continue to exist?
Absolutely. That is how you get statewide coverage, and that is how, in addition to Washington County and Chittenden County, you have coverage in other places where there is not the infrastructure. There are certainly people who need to collect money that they're leaving on the table who live outside of those 2 counties. But again, I understand it's not the merits.
So the question is, how, for the agencies that have the programs now, how does that funding flow? Because I think what Senator Westman's saying, are we creating a bifurcated funding structure?
Yes.
And do we,
That's my question.
how are those 2 agencies, how do they fund their programs?
They're currently funded through DCF's OEO. But I frankly, I think if you look at the CAPS budget, my lord, they have so many different funding streams. I think they're perfectly capable
No, we're
of
talking
having.
about how the appropriation flows. Well,
So
maybe.
if there's a simpler way to do this, we would be delighted to do it. What we heard was, oh, we need 2 more staff
Well, they
people,
did
which
say
we
that.
thought was,
We thought it
Just
was a
not.
little, actually, I spoke to the commissioner, I said, 2 positions, are you talking about? And he said, well, we have no experience in this program. And that's why it's hard to reconcile the fact that we've got 2 agencies providing this service. It used to be years ago, the case managers used to do this. Working with families used to. And I'm talking about back so long ago, it was back, probation officers helped, social workers helped to get, not only the sales tax rebate, the renter's rebate, et cetera. That was all part of how you serve families. Obviously, the world has changed, but it would be interesting to know, and maybe we can find out, Joint Fiscal can find out how the 2 programs now are currently funded. You're suggesting it's flowing through OEO, which is part of DCF, which is hard because the commissioner said they didn't have experience with this program. And then what is the funding source? And then are we it's your way of creating a single funding stream as opposed to multiple, one through treasurer and one through another part of state government. That's what we're trying to figure out.
Yeah, so I would like to continue sorting it. We certainly hear that the fundamental question is one of money and the priorities associated with that. And we know we can't answer that, but you're hearing from us that this is, we think it's a program of merit and should be expanded so that all Vermonters have, all low-income Vermonters have access to it, not just those who are fortunate enough to live in the cap basins that can take care of it. I wish that we still could provide those services in the way they used to. Kind of anytime you touch state government, that they could say, help us.
So the other question I have in this is the 400 in the documentation I've got talks about the 400 being shared by the 5 cap agencies. And so if I have 2 that are already offering the program, I don't understand what's happening with the existing money that's running those 2 in relationship to the 400 if they're talking about doing the 400 split.
Those are being deeply subsidized right now by the caps that are doing that. And it's a very heavy lift that pulls away from other benefits and other work. And the other thing I would add, there's another, I think, multiplier effect that's really important with this program. And I know I'm talking on the merits, but when you're sitting there with someone's income in front of you, you can tell them you qualify for LIHEAP, you qualify for weatherization. It was astonishing to me. I had multiple conversations with people who run the programs. How many people are leaving those benefits on the table in addition to all the other federal dollars or tax credits to which they're entitled? So I see this as such an efficient multiplier. And I fully take your points about how to do it in terms of which mechanism. And I think Chair Hooper has made clear that we can think that through a little further. But to me, this is the kind of smart government that I would like to see more of.
Well, I
think it
don't
makes so much sense.
disagree with you. And one of the positions that I really don't think we need to get a handle on, and that's our reach out caseworkers, because they should be doing exactly all of this as part of their case management responsibility for all the families receiving those benefits. And that is inherent, I think, in looking at the economic security, helping them with housing. They were intended to be really prevention because they should be in homes seeing families, and those families are all high risk. They're single parents, most of them. They're poor. If you're on reach up, you're abjectly poor. And many of the other risk factors are present in those homes. And so, and by design, originally, those reach up workers were to be that first line of family support and human capital development on the part of the parents. I think it's morphed into more of an employment focus than looking at the whole needs of the family. And that's, I think we had actually, we had some language and from a while back, because the DCF had proposed and ultimately agreed to discontinue the contracts for case management services with our parent-child centers and wanted to bring it all in-house. And we had a lot of discussion around that, and the design and trying to connect families with those helping systems. And I mean, that was part of the whole design that got pulled away. But the question, because of the smaller caseload, but for me, the question is, how are those jobs currently being defined? How are they being conducted? Because they really represent a significant investment in human resources to the very families that are the poorest and most at risk. And I realize I'm preaching, but I'm speaking from direct experience, because I was there to design it and think about the policy basis as how to intervene with our high-risk families where your risk factors are well demonstrated, in such a way that those families are supported in comprehensively. And I think maybe we need to get an update from the department in terms of how that role is perceived and how it's being executed. Because when I met with the Parent Child Center folks who were out visiting the families in the motels
Yeah.
and making sure the meals were, I said, well, and they had established a very close working relationship with family services, with child welfare. I said, well, what about the reach-up workers? And they kind of looked blank and said, well, they refer them to us.
Yeah.
It was like, well, that's distressing in terms of how that might work. It might be good if that was just part of the plan, but to have sort of a response about sort of vague in terms of what they were doing with these families, it was, and that's why certainly we had language about home visiting, because they weren't doing home visiting. Well, how do you assess home conditions that the children are living in? And make those kinds of assessments. So if it's all office-based. And I think that was done at the time we discontinued the contracts with Parent Child Centers, which was maybe 2 or 3 years ago. Do you remember? It was quite a battle.
3 or 4, maybe. And we were driven by money, unfortunately. I think we were.
Well, the issue was
Yeah,
whether we
was-
kept state employees or whether we discontinued the contracts.
But it was financially, I mean, it was at a time when we were looking to cut everywhere. And I personally totally agree in terms of the sorts of services that we ought to be providing.
3 years.
3 years ago.
Was it just 3? It was right before.
It was
the
right
pandemic.
before it was the last, and
So we ought to look back in terms of the language we put in at that time regarding, the home
Yeah.
visiting and so
part
forth.
of my problem, we did not to rehash old history, is, the family centers were sending people out and meeting people where they are, and to come in and have to go into a state office, a lot of people find that intimidating.
Well, the other thing is you're not seeing the environment in which children are living. And how do you assess risk? And how do you intervene in a positive, supportive way earlier on? So we're getting off the track, but I guess what I'm saying is we are investing in caseworkers that we're not sure, we're not clear exactly how that role is currently being defined and how their work is being executed. And this is a larger discussion, but it does tie into what we should be, I believe we should be expecting as part of that whole case management structure.
Can I just say about the 400, and this is not about the mayor, I'm still trying to understand it. As I understand it, it was not 2, it's 5 positions. And the 400,000 is based on 80,000 for a tax coordinator at each CAP agency. So they talk about police support funding for 400,000 for 5 full-time EITA program coordinators, 1 at each of the 5 CAP agencies. So it was 5 positions in the CAP agencies.
Okay.
So I'm just trying to.
Okay, well, so let's sort this and get the correct information,
And then we'll just have to prioritize how we want.
how we want to spend money.
Can I just
and-
do a parking lot issue?
Okay.
With Reach Up, there is the Reach Up bill, which does have some money attached. And if we
So-
at some point get to bills, I just want to flag that that's currently in this committee.
Yeah, I
too.
know that.
And I'm not here to talk about it, but we're on the topic of Reach Up.
Yeah, no, we haven't, we spun out 9 bills in 2
Yeah.
hours the other day.
Yeah. We know about that, yeah. Okay, so we need to get better information. We're saying to you, we believe this program has merit and a concern about spreading it to the entire state, so it's not just in some areas. We hear the questions and we'll do some work on that and obviously understand And at the end of the day, it comes down to prioritizing how.
And
we're
how big a
spending.
revenue box we have.
Yep.
Um,
Yeah.
And obviously, we've talked about when our priority was on protection and early intervention and seeing if we can start bending that curve on children coming in to care, which has been very troubling to us, very troubling to see the number of children who are removed from their families.
Okay. So we have nothing else. We would like to have more. We're anxious to get to the bottom of the list and that kind of
E
stuff.
317, it says position in Billings for Family Services. Is that just a technical correction?
You don't need to change the language at all, you know.
I just haven't had a chance to swing back to,
This is the review by the judicial masters on
Yeah.
police, we get 60 days.
Yeah, it was in order to comply with the federal Families First legislation. It was in your bill.
You just put it in child development instead of family services, we just moved it to family services.
Because it's,
oh, that's right. So Kimberly, you know this.
Yeah, you know what, I would
it's
like
just a
to
better
take,
replacement.
right,
Yeah,
I
just-
would just like
just
to
give
have
us-
a few minutes to be
Yeah.
able to read
Yeah.
it, and then when we meet again, I take the point that it's technical, but I just can't call it up from memory.
Okay,
So we'll get back to
yeah,
that.
we just saying it's child welfare required, it's part of Family First legislation.
Right.
And it got put in child development, not family
Okay.
services. So it's not changing the language at all, it's just simply putting it in the budget in the right division.
Yeah, Senator Westman and I sat on that joint child oversight, we heard quite a lot about it this summer and fall. So,
Okay.
So, we'll just hold that to take a look.
thank you.
And then, Green Mountain Care 345, I don't know what the status is of the bill. You had 4 million, we had 5 million. This had to do with, both the renewal waiver board and then, getting into global budgeting at the Green Mountain Care Board. And we struck it because we had already appropriated the money and we had a bill that kind of fleshed out things. Do you know the status of this?
The bills in our committee. and
That's
we're-
285 is?
Yes,
Okay.
285 is in our committee, and we're having a conversation specifically about the money. And as you noted, in the budget, we had 4, which was a placeholder for the bill. You did 5. And so I'm sure that we need to get that bill out
So
quickly.
if we do move 285 forward, 285 separately, then all we had done is strike that section. because
Yeah, we just need, and the question is, what's the right amount of money? And we're still sorting that.
All right. So your plan is to take action on the bill
Yes.
and move the funding through that bill?
We'll
not
move the
budget.
funding through that bill. I'm having a hard time seeing 5 million there, so, but that's just continues to be our conversation about what's the right amount.
Yeah, we did have some additional communication from Donna Kinzer in terms of the amount she thought global budgeting would require. And I think she was thinking the amount we had was minimal at best.
For the Green Mountain Care Board
Yeah,
or
for the
for
Green Mountain Care Board.
AHS?
For the Green Mountain Care Board.
Okay, yeah. So, I mean, there's the Green Mountain Care Board and how much should we do there? And how much should we do for AHS? And does AHS have a capacity to find money elsewhere for these initiatives? And I don't know the answers to that. So
Well,
we need to get them
it
quickly.
seems like your health committee would have.
Yes, and they have. Yeah.
All right.
Okay, so we're scheduled at 1. We can try to bring you back some additional. Or do you want,
I'm just thinking if we, I'm just thinking about the bills. I've got to get out of this committee today. And everybody is standing outside the door, sort of saying, when are you gonna get it out? Unless you think you're gonna have a lot, maybe we should just meet at 3, and that would give us more time as a committee to get the bills out.
Okay,
And it would give you a bit more time to go through the list.
okay, and we're, called in other places too, so
Yeah.
just as you are. Okay, so 3 o'clock,
3
and
o'clock.
we'll do our best to bring you more.
All right, thank you. Thank you.
Great.